Hello and welcome. This is Dr. Gerard Cuomo. I'm filming live with an incoming rescue case. This is a Nobel Biocare case that is an all-on-4 upper. The patient presented with a fractured flange, a denture flange. There is no metal reinforcement, so our job today is to make sure that each implant screw has a passive engagement with the all-on-4 abutments, or what they call a multi-unit abutments. And once I do that, we'll be able to lute this case together. We may remove the pieces, look at them, clean them, and put them back in place, because with separation there's food that has lodged, and you can actually see that the two members are on different planes horizontally. So we may want to straighten that up and then adjust his occlusion before luting the pieces together, and then removing it, looking it over again, and then replacing it, putting it back in place, checking the occlusion and the passive fit of the screws. So there's a lot to do. We'll try to film as much as I can, and one step at a time is to uncover each one of the composites or each one of the screws where the composite is covering. And we're going to go right into that now, and also remove the Teflon that was reported that was in there. All right. So first things first, actually, I'm going to come over here to the left side. I just move my camera a little bit. Perfect. And we'll zoom in. So even though my mirror is well out of the water spray area, so we can keep that just the way it is. And just going to gently, ever so gently, remove the composite. Okay. And right now we're down about 2 to 3 millimeters. Still on composite. I'm going to increase the magnification. Alright, so we're all up to 8 power now. And we're just starting to see a little of the Teflon now. Again, I'm inside the cylinder of the temporary abutment. And here we go, now it's starting to come out. Just a little bit more. There we go. And I'll take a long explorer. You need to swallow at all? You're okay. Everything's going well. So I'm just going to take an explorer and just see if we can. Here comes our Teflon. And out it comes. All right. Open a little bit wider. Perfect. There's the screw. Now let's test the screw. And I'm going to just ask if I can just tilt him back just a little bit. There we go. Still good? Mm-hmm. All right. Perfect. Now we can see. Now I'm just going to go down just to see. It looks like the top of the screw is pristine. It's not showing any looseness at all. So this is just checking with an explorer now. All right. So we know that that one is holding, but there is separation, so something is moving and separating. All right. So again, I'm going to uncover the next one. So step 1 is out of the way. This is step 2. And again, we'll just keep doing this until we remove them all and uncover them all. This one's a little more shallow. Alright, and just the key also is to make sure that that you don't have any composite up and down the wall. You don't want anything to fly off and get in the way, so try to get it all out of there. Okay, so here comes Teflon number 2, and we're going to keep this. This will tell us how much you used. Put that right over here. That's number 2. So it looks like just a normal amount. Now this one is different. This one, the top threads are all marred on top of the screw. So this one has got material inside of it. So we got to clean that up. So this is number 11, I guess, or it's going to be number 10 position. 10 or 11. It's located more toward the maxillary area. So this one I would pre-soak and a little bit of tartar and stain, because that's tartar in there or something in there. I'm going to pre-soak that one. So I'm just going to use a little bit of tartar and stain. I'm actually going to move to the next 2, and we'll come back to it. I'll move to the next 2, then we'll pre-soak that. No problem. No problem. Plenty of time, yeah. Okay, so this is it's in the number 7 position. So we're going to do that one next. And that's for us is the upper right lateral incisor. All right, so that's where this one is positioned. And patient realizes he's going to be without his upper prosthesis for most of the day today and tomorrow morning. So this is an overnight repair in the laboratory. We're going to take an initial step is to secure the base with a wire mesh. That would be our accepted treatment plan today, is to get the patient comfortable again and more confident that so this one is showing a little bit of fatigue as well, so we'll be pre-soaking this one. I want to just zero in on that one. Oh, sorry, go ahead and swallow. Okay. So you can see that when you place the driver in the head, it has to fit passively and it has to be secure. That one I can't tell on number 10. This one you can show. And now, so it might behoove us to change out the prosthetic screws and give him all new ones when he comes back tomorrow. So that kind of makes sense. You know, you don't want to, if something looks worn, you want to change it out. It was suggested that once a year he should have the small prosthetic screws changed out, just from a hygiene and wear and tear. We usually go every 3 to 4 months of maintaining. All right, so this one is now out, and I got a little bit more to remove here. There it goes. That on your tongue? Anything on your tongue? Okay. Okay, turn toward me. All right, let me get the suction. All right. We'll be right back with the next video clip as Dr. Gerard Cuomo with an upper fixed denture flange.